Epidemiology. There are a lot of venous ulcers. There are a lot of like leg ulcers. There are a lot of wounds associated with lymphedema, phlebolymphedema, and other causes that affect the lower extremity. And you have to keep in mind that you're not necessarily just dealing with these. This little other component rears its ugly head every day or every couple days in our clinic. Something comes in that just isn't quite kosher. It's not quite right. It's something that we want to biopsy or that we want to do more extensive testing on and more evaluation on. And it's not just these, but almost every patient I see has these in there. And what's not in there in that slide is what? Any kind of lymphatic insufficiency. Why? Because this is a classic old slide on epidemiology. And this is exactly the way we were taught. It's exactly the way we are taught. We're still being taught. And what should be in there is a percentage of patients with lymphatic involvement, and it would be probably everybody with venous insufficiency, many patients with arterial, most of the patients with diabetes and edema problems, and then all the other associated things which have lymphatic component involved or a lymphatic component in their wound. Most of these patients would have it. It's important to take a good history so you get a feel for how long has this been going on. One of the things that Heather mentioned before was how long have patients been having a lymphatic or an edematous problem with their legs and didn't do anything? So lymphoscintigraphy is available where you can inject into the like a radioactive substance into the lymph system and kind of watch it migrate through the leg and take pictures as it goes along. Detect slow or absent flow, reflux, areas of reflux. You can kind of see the lymph drainage associated with it. Where is it? Where does the lymphatic flow go? Where are places of restriction? Does it have to make some sort of squirrely turn to get out of the leg where maybe that could be facilitated? You can locate sentinel nodes. If there's some area that's really infected or inflamed or where they have cancer or something, you might see that. And then essential for congenital lymphedema, determining whether a patient has a congenital problem.